Fast forward to today, and we still face the same issue, but now we know constipation is more than just an occasional inconvenience, it affects people of all ages. From babies, who may struggle with digestion or experience discomfort from formula or solid foods, to young children facing stress or diet changes that disrupt their systems. And it doesn't stop there, young adults, too, are grappling with the pressures of a fast-paced life, unhealthy diets, and stress, all contributing to their digestive challenges. Even older adults and seniors, whose digestive systems slow with age, often experience chronic constipation that can lead to complications. And for those who are even older, constipation can become a daily battle, sometimes exacerbated by medications, lack of mobility, or just the natural aging process. The constipation starts when food moves too slowly through the colon, causing excessive water absorption and resulting in hard, dry stools. Due to the harder stools, passing them becomes painful and difficult, often causing discomfort and straining. Constipation occurs when the bowel movements become less frequent or difficult to pass. Various natural factors can contribute to constipation. Factors: dietary. Fiber intake. Fiber helps form soft, bulky stools. A lack of fiber from fruits, vegetables, and whole grains can lead to constipation. Dehydration. Not drinking enough water can cause stools to become hard, low, and difficult to pass. Processed foods. A diet high in refined carbs, fats, and low in fiber can slow digestion and lead to constipation. Lack of physical activity. Physical inactivity can slow the movement of food through the digestive tract. Ignoring the urge to go. Regularly ignoring the body's urge to defecate can lead to constipation. Medications and supplements. Certain medications, like painkillers, iron supplements, and antacids, can cause constipation as a side effect. Stress and anxiety. Emotional stress can affect digestion, leading to constipation. Aging. As people age, their digestive system may slow down, leading to constipation. Aging. As people age, their digestive system may slow down, leading to constipation. Lifestyle changes. Increase fiber intake at least 25-30 grams per day from fruits, vegetables, whole grains, and legumes. Drink more fluids to help soften the stool. Regular exercise, such as walking, to stimulate bowel movements. Avoid straining. Refrain from prolonged straining during bowel movements to avoid complications like hemorrhoids or anal fissures. Medications. If lifestyle changes aren't sufficient, healthcare providers may recommend medications, laxatives, stool softeners, or prokinetics to relieve constipation. Medical monitoring. In cases of chronic constipation, doctors may look for underlying conditions like IBS, hypothyroidism, or diabetes. Irritable bowel syndrome, IBS. IBS with constipation, IBS-C, is a common digestive disorder where constipation is the dominant symptom. Diverticulosis. Chronic constipation can increase the risk of developing diverticula, small pouches, in the colon. Colon cancer. Although there is no direct cause and effect relationship, some studies suggest chronic constipation could contribute to an increased risk of colon cancer due to prolonged exposure of stool to the colon walls. Rectal prolapse. Severe, prolonged straining can lead to the rectum slipping out of place, requiring surgical intervention. Abdominal discomfort. Constipation can cause bloating, cramps, and discomfort due to the accumulation of stool in the colon. Hemorrhoids. Straining to pass stool can lead to hemorrhoids, which are swollen blood vessels around the anus that can cause pain and bleeding. Fecal impaction. Severe constipation can lead to a buildup of stool in the colon, requiring medical intervention. Anal fissures. Hard stools can cause tears in the skin around the anus, leading to pain and bleeding. Toxicity. In rare cases, constipation can cause toxins to build up in the body, leading to general malaise, fatigue, or nausea. Decreased quality of life. Chronic constipation can significantly impact daily activities and mental well-being, causing frustration and a sense of discomfort. Constipation may be a common condition, but it is far from a trivial one. By understanding its causes and implementing both modern and traditional treatments, we can improve the quality of life for millions worldwide. From dietary changes and exercise to advanced medical treatments and natural remedies, there are countless ways to overcome this condition. By spreading awareness and applying the best scientific practices, we can empower individuals to take control of their digestive health and live healthier, more comfortable lives. Please, darling, subscribe this channel. Please subscribe for more tips. Constipation may be a common condition, but it is far from a trivial one. By understanding its causes and implementing both modern and traditional treatments, we can improve the quality of life for millions worldwide. From dietary changes and exercise to advanced medical treatments and natural remedies, there are countless ways to overcome this condition. By spreading awareness and applying the best scientific practices, we can empower individuals to take control of their digestive health and live healthier, more comfortable lives. Please darling, subscribe this channel. Please subscribe for more tips.